The unique story about Big Sky Medical Center, when I came to look at Bozeman Health as a professional opportunity, it was the first facility that I visited. And I thought, gosh, what a gorgeous facility built in the mountains. The intersection of health and well-being from nature and the activities that were there, and more importantly, just the passion that I could see from the staff and also from the community leaders. I just walked away blown away with how phenomenal it is, but more importantly, the magic of that facility isn't purely fulfilled until you put talented and high caliber healthcare providers and healthcare team members. So when we think about Tracy Remy, our first administrator, Chris Darnell, and now Dr. Burtney, each has stood a little taller on the shoulders of the preceding leader. And I think they have just really developed this cumulative effect of commitment to the community and the commitment to leading well. And I just couldn't thank each one of them enough for the work that they're doing. And today we have our very, very talented Taylor Rose, who is leading our daily operations and doing a phenomenal job. And I think every time we get a little bit better knowing that we can rely on the great leadership of those from the past. We have leaders in the community who dedicate their time and service to guide us as healthcare leaders in their board capacity, and they have the ability to see things and understand things that perhaps we don't see and know on a daily basis. These board members have just been spectacular in balancing the needs of our team members who they know are members of the community, they know and leisure and worship with them as well, and really bringing that humanity into their leadership as board of directors. And I would say at the forefront has been Taylor Middleton, who has just been a driving force for decades in the Big Sky community, and to be a part of his vision to support the growth of that community and specifically the resort areas, knowing that Taylor has a very personal connection with not only the community but individuals in the community that he often thinks of when he makes decisions or recommendations to executive leaders of Bozeman Health and to our board as well. He keeps that individual value of providing services and caring, if not curing, certain members of the community, but then is able to really think clearly about how will this benefit the community as a whole. And what I so value about Taylor is that not only is Big Sky the community itself something that's at the forefront of his mind, but he's often been able to think, through the valley. He's gone to West Yellowstone. He's contemplating those needs. What happens in the national park, and how can we benefit the services provided to those from across the world that come to the national park or to Big Sky Resort? And I just think that his vision and his heart is not only a tremendous value and priceless gift to the Big Sky community, but it's really radiated much beyond that, and for that we have a lot of gratitude. Here we are 5 years later, and we look at this and we say, gosh, it was the right decision. We had the right leadership in the community to support us. Our teams are phenomenal. They are just tireless in their work and support of our community health in those communities. And I just think I look back with a lot of gratitude and a lot of optimism that that was the right decision. And again, very, very proud that Big Sky Medical Center is a part of our family.
Thank you, John. It's hard to believe that we were all here 5 years ago. It seems like yesterday, opening this magnificent facility. It's magnificent not because of the facility, but it's magnificent that we accomplished it and the people that are here making it possible. For those historians among you, you remember what it was like in Big Sky before we had a hospital. We've talked many times, we talked 5 years ago, having a hospital in our small town, it's a big deal. It was a big deal then, it's even a bigger deal now. Why is that? Before we had a hospital, we would have to drive all the way to Bozeman for the little things. And we would have to drive all the way to Bozeman or be taken all the way to Bozeman for the big things. Now we can do it 5 or 10 minutes from our homes, and we get really good medical care right here. That's a big deal. How did our town do it? It was hard. It was a lot of work. Many in our community have been working for 15 years to get a hospital in our town, and we just couldn't figure out how to do it. It was too complicated. It was a bridge too far. It was too expensive. Our town wasn't big enough. How did we do it? Our friends from Bozeman Health came to us, and without any commitments from our community, They, Bozeman Health, the community of Bozeman, the board of directors, the wonderful leadership of the hospital decided to give this hospital to our community. Since then, our community has embraced it, has given to it, and we've worked collaboratively to make this happen. I want to call out a few people, just a few of the countless people that have participated in this the whole way through. Our community council, our original community members that helped, Hans Williamson, Lauren Bow, Steve Carl, Renee Schumacher, Dr. Kirk Weber. Those were on our original community council. Since then, we've added some more key players in our community who are giving their time. Heather Morris, Beth Hoffman, Alan McLean, Nancy Scheel, Carrie Chapin, Mara Mitchell, Susan Darden, Dan Taft, and Mark Eckert. Without these people and so many more, we wouldn't have had nearly the support from our community that we've had. This is a piece of the puzzle that we're filling in, and it's only one small piece. There are many. To help understand that, let's keep going with the show.
When we first opened, we had a large opening where the community was able to come, and I had so many people come up to me saying, oh, we delivered our children in the canyon, or, just accidents that had happened and how far they had to drive to get medical care.
Stepping into Big Sky Medical Center when it was finally completed was quite a day.
Big Sky Medical Center was very fresh and unknown at that point, and didn't really know what it was going to become.
Now we had all these resources, and we had these things that we couldn't do before that we could do now, and people to talk to and bounce ideas off of.
It was definitely a nervous excitement, the kind that motivates you to want to be as best as you can.
It was great to actually start seeing patients. It was great to start providing care after all the work we had done.
We were all brand new, so I feel like that kind of started our bond because we all pulled together.
When Big Sky first opened up, my first thought was, wow, this is a new hospital, and it's at the bottom of Ski Hill, so the care was really ortho-focused.
One of the things that I realized is, I'm now a part of this community, and how nice it is that we can provide care to those who live here year-round.
I've seen our continuity of care get better in lots of ways. Patients that are seen in the emergency department are then seen in our clinic.
Our primary care base has grown from 1 full-time primary care provider to 3 at this point. So we've had a lot of rapid growth in 5 years.
I think the culture here, because we are so small and lots of us have been here together for the last 5 years. Professionally, we work as like a well-oiled machine, but personally, we've seen each other get married, have babies, have loss.
It's fun to see the relationships in this hospital and members of our staff and how they're related to other people in the community. So we have nurses that are ski patrollers, we have staff that are married to the Big Sky Fire, EMS and paramedics that we work with on a real close basis. You really get a sense of community here.
One of the biggest accomplishments that I think at Big Sky Medical Center has been the implementation of telestroke. So we have patients who come in who are in a situation where they are having a stroke, and we are able to reach the highest level of care via telehealth, get them to the place they need to be, and hopefully increase the positive outcome.
I'm thrilled and just proud to be a part of this. People are wonderful, and the facility remains to be state-of-the-art and beautiful.
This beautiful building, over 50,000 square feet of rugged, exposed steel, wood, stone, and glass, reflects the amazing natural beauty outside our doors. But it's the wonderful people that are providing 24/7, 365 services that really make a remarkable difference in this community. Our emergency department team of nurses and doctors has cared for more than 18,000 visits. The medical inpatient team, including nutrition, environmental services, the biomed team that keeps everything working, as well as our supply team, and of course, nurses and doctors, Working together, have cared for more than 325 patients who've stayed here overnight. We initially had a 4-bed unit, and during the COVID pandemic, the generosity from Philanthropy in our community has increased the size of our unit to twice that. We now have 8 beds to serve patients when they need it. Our certified radiology techs have completed 20,000 studies, including X-rays, MRI, CT, and now ultrasound. Certified lab technicians, now on site 24 hours a day, have resulted over 55,000 tests. And that doesn't include all the COVID tests that we staffed but didn't run. Pharmacists and pharmacy technicians serving the emergency department and inpatient units around the clock also staff the community's only outpatient pharmacy, open 6 days a week to fill prescriptions for the community members that need them without having to drive up the canyon, have filled over 125,000 prescriptions in just 5 years. The primary care clinicians provide wellness and prevention services along with chronic disease management. And it's really the members of our community that live here full-time that rely on that team of doctors and advanced practice clinicians, and they've seen close to 25,000 clinic visits to date. We're so fortunate to work and live in a community that truly cares. Bozeman Health is appreciative of the opportunity to be a founding member of the Big Sky Behavioral Health Coalition. With the motto, "Together, we will create a health community where everyone has access to high quality of life," Bozeman Health has now added 2 behavioral health specialists to our clinic team to deliver direct mental health diagnostic, therapeutic, and treatment services. And there are plans to double that team within the coming months. Bozeman Health is proud to serve the community of West Yellowstone, as well as visitors and employees of Yellowstone National Park. And so Big Sky doctors work a clinic at the Community Health Partners in West Yellowstone every single week. In addition, since 2016, Bozeman Health's mobile screening program, the Healthcare Connections Bus, has made 25 stops in Big Sky and West Yellowstone, providing over 1,000 free visits for preventative health services to our community. And during the COVID-19 pandemic, Big Sky Medical Center has partnered with the community to provide support for testing, make available separate viral triage and treatment services, and staff vaccine clinics throughout the community. I believe to date we have delivered over 700 vaccines in our community, and that's pretty remarkable when you think of the size and the percentages that we're getting to. I was really brought to tears by the amazing generosity of this community in supporting Big Sky Medical Center during the pandemic. It was our community's philanthropy that stepped up and assured that we had all the equipment, resources, and facilities so that if a surge happened here, we could manage patients close to home, in addition to having the greater resources of Bozeman Health. And with all the care provided at Big Sky Medical Center, one could conservatively estimate that we have reduced millions of miles and hours, thousands of hours of travel through that canyon to get to the critical emergency and necessary preventative health care that we all need. Having that care available in our community for time-sensitive emergencies is truly priceless, and I'm so grateful and proud of the dedicated family of caregivers focused on safety, quality, and really providing excellent patient experience for our community here at Big Sky Medical Center. They truly deliver on the Bozeman Health mission to improve community health and quality of life.
CHNA is the Community Health Needs Assessment, and as a nonprofit healthcare system, Bozeman Health does one every 3 years. We're still seeing that a high percentage of community members will say that their own mental health is fair or poor versus good, great, or excellent, and that's obviously not what we want to see in our communities.
Living in a place like Big Sky does come with some challenges. It's not all paradise. There's some isolation, particularly with the pandemic. It's more difficult to receive services.
I mean, resort communities are places people like to party and have fun. So one of the things we have to keep a close eye on is our substance use.
A lot of kids are dealing with school-related stress, family-related stress, job-related stress. Seeking help after that is a struggle because of the stigma.
Prior to Women in Action bringing in therapists, prior to the hospital having therapists and clinicians, people were having to drive to Bozeman to get the type of assistance and help that they needed.
There was really a lack of resources, and that's one of the reasons that behavioral health was such a significant need up in Big Sky.
We work closely with our operational leaders to more fully understand what's going on from a clinical side and how our community benefit strategy can complement that work that's already going on clinically.
Dr. Maidman was one of the associate medical directors with Western Montana Mental Health Center, and recognizing the need, Western Montana Mental Health Center let us contract for some of his time to serve Big Sky. And Kathy Damberger was teaching at the university, at Montana State University, and we reached out to her and she agreed to also provide services up there.
There's just a tremendous amount of work that we're part of, sort of destigmatizing issues around behavioral health and really creating the idea of a healthy body, healthy mind, and what does that really mean? And how do we really open up the door to talk about things that really bother people.
The more resources we have from all sorts of different avenues and perspectives to bring people to that state of contentment is so important.
We are an open clinic for people in Big Sky, so you don't have to be assigned to a primary care physician. If you need help, we want to be available to give you help. We do now have the 24/7 telepsychiatry, which is available. And we formed partnerships with some of the community providers so that they can deliver telehealth. We're also exploring some of the digital therapies that are available so that people can be able to do self-monitoring and self-regulation at home. And then we're also looking to partner with Madison Valley Medical Center to see if we can't bring some therapists to Big Sky for the patients who just need some additional support, counseling, and therapeutic interventions.
There's a lot of momentum right now towards mental health. The older generations are realizing that, hey, we have to help the younger generations. And so we're gonna make the efforts. We're gonna help them, sort of a combined effort, a coalition of people sort of seeking to make and attempting and trying and striving to make a change.
I think we all have heard the term, it will take a village. It's going to take all of us working together.
We can really continue to live in this beautiful environment and see it as this beautiful environment when we have this support within our community and within each other to show up for one another and to continue to stay strong as a community.
Hello, thank you for that. And about 1 year ago today, I joined Big Sky Medical Center and became part of the team here. My first year in Big Sky is much different than I originally anticipated it. I like to think that I've not seen Big Sky in normal conditions, and operating a hospital through a COVID-19 pandemic has been quite the experience. What I've been able to learn over this last year is the incredible team that we have here in Big Sky. The providers, the nurses, the frontline staff, all the workers that come in day after day and address the situation in front of us has been incredible to me. And demonstrating gratitude to them on behalf of the community is something that's really important to me, and just conveying the gratitude that the community feels to them. One example of gratitude is our frontline staff, our registration and patient access staff that's been on the front lines of everything COVID related. They have been the ones that have answered hundreds of thousands of calls addressing questions from at the get-go of, do I have COVID, am I at risk, then how do I get tested, then now we're moving into this phase of, can I get vaccinated, where do I get vaccinated? Literally spending thousands and thousands of hours addressing the needs of the community over the phone and in person. And a special vote of gratitude to them goes out from my heart just for everything that they are doing. Now, also we have our providers and nurses who have had to change the way they think of care in the Big Sky community over this last year, and everything that they've done to care for every single patient, not turning any away that come into this facility, and not being scared of what COVID means and how it could impact them, but diving headfirst in to addressing the patient's needs before their own. So a huge vote of gratitude goes towards them, and Big Sky Medical Center is more than what I've witnessed it of as is addressing the COVID-19 pandemic. They've been here now we're celebrating this 5-year anniversary of Big Sky being here, and the thousands and thousands of patients that we have been able to help has really uplifted and strengthened this community. There's 68 people that we have here on staff at Big Sky Medical Center, and 18 of those people are original staff members that have been here since we opened. I just like to read their names because they are the foundation of our workforce here in Big Sky. So we have our providers, Dr. Jeremy Mitchell, Dr. Maren Dunn, Kirk Weber, and Phil Hess. Those are all doctors that most people in the community have been able to see one time or another. We have Danielle Donovan, Rochelle Earle, Christy Fletcher, Amy Frey, Cord Holmes, Erica Jenkins, Odie Loomis, Michelle Michaels, Margie Orton, Emily Porter, Kelly Reynolds, Wendy Rogers, Heidi Silver, and Lacey Wood. All 18 of these members have been instrumental in building everything from the beginning. In each one of their departments, they've had to develop and craft new policies and procedures and really invent healthcare in Big Sky. So we're deeply appreciative to the hard work of all the original and continuing staff members that we have here in Big Sky. The many hours and overtime that they put in here is, it's truly goes to show the love and support that they have for the community. So with that, I will turn it over to Jason to give you some more information. Thanks.
Well, thank you, Taylor, and thank you to all of those who have taken time out of what we know is a busy week and a busy day to join us as we celebrate Big Sky Medical Center's 5-year anniversary. On a very personal level, I can't believe that it was 5 years ago. So many across Bozeman Health, together with our colleagues at Langless Construction, and the original generation of Big Sky Medical Center employees were getting ready for this day by stringing electrical and computer cable and wiping down construction dust and making sure that as we opened the doors on this gift to the community, it was starting as good as it possibly could. It would also be an understatement for me to say that I come into today with a tremendous sense of gratitude. We've heard much about the role that our incredible care team members have played in advancing care in this important community and throughout Southern Gallatin County. But every time we have turned to this community with a big and bold idea or a need to grow into what's next, they have been there with and for us at every turn. I don't know that we could have estimated or anticipated the incredible philanthropy and generosity that we've seen throughout this 5-year journey. Here's one really powerful example of how a patient's experience translates into a new opportunity for our community. Enjoy this few-minute video, and I'll be back with you after it runs.
The Big Sky community as a whole is a family. We have seen people do so many things for other people. Never has there been a time where I felt that I didn't have backup or somebody there for me if I needed somebody.
Big Sky is a very generous community, and that has been helpful in a lot of ways. It allows us to have some more tools and services that we would otherwise not have. We have more imaging modalities than many communities our size.
I wiped out, and my knee was pretty painful, and they said you should go in and have it checked out. Went and see the doctor, And she says, well, you know, we think it could be this, but the only way we can confirm is we need to take an ultrasound. And I said, fine, let's go and do it. She goes, well, we don't have an ultrasound machine here because you have to go to Bozeman. We started talking about it, and the doctor also told us that the ultrasound has multiple other applications aside from just, you know, what I needed for the knee.
And then I thought, well, what do the pregnant women do who are in, you know, this area? Do they have to drive all the way to Bozeman just for a simple ultrasound? And sure enough, they did. So I think we both thought they really need an ultrasound and maybe we could help.
I found out they were going to start offering ultrasounds probably right when I got pregnant, actually. I do what we call the reverse commute, so it takes me usually about an hour to get to work from here. Kind of was serendipitous and really worked out that it coincided with when I gave birth and being able to be close to home.
From the Utengsus, who most recently have allowed us to bring ultrasound, to the Stevenson family, who enabled high-quality MRI and expanded behavioral health services, to Len Hill and Patty Gordon, who allowed us to improve our emergency department, to YCCF, Spanish Peaks, Moonlight, and their affiliated foundations, countless donors who have been alongside us throughout this 5-year journey. You've really helped to make a difference.
I think Carrie and I hope that with having the ultrasound there, that mothers-to-be won't have to make that long drive into Bozeman when they need to have an ultrasound.
I think this will benefit the community more than even people realize. There's so many different ways we can use ultrasound.
We're overwhelmed with a sense of gratitude and a genuine sense that we've been able to reach further because we've been in this together. So as we celebrate 5 years of exceptional care to those in need through Big Sky Medical Center, we wish we could be with all of you face to face, up close and personal, celebrating this major milestone. We also wish that we could be together as we unveil Big Sky Medical Center's Founders Fund wall. You'll remember that 5 years ago, a small group of us gathered and gave consideration to what we might do to memorialize those early stage investments and contributions. And we thought, let's capture all of those who are willing to lean in with us over the medical center's first 5 years. We've done that. Our Founders Fund is now locked, with tremendous gratitude to all of those who have made their generosity known to us for the benefit of those we serve. Really pleased to share with you now the 5-year Founders Fund wall for Big Sky Medical Center. Thanks so much.
As I look at the history, I think that there are really 3 phases. Phase 1 was figuring out how to get a hospital in our community. Check. Phase 2 was getting our hospital built and this facility open. Check. Phase 3, it's about constant improvement, continually making it better, serving our community needs, serving an ever-growing community. That's what we're going to be doing forever. What's next? The future is bright. We're going to end with a video that helps paint that picture. But before we do, I want to thank all of you for joining us today. I look forward to doing this again in person next time. Thank you so much.
The Big Sky community is always changing, I feel like. It's changed a lot even since I've been here.
It's just continually growing. I mean, I can't believe I've been here 5 years now, and the amount of people that have moved into the area, it's been impressive.
My goal for our community is to continue to grow in a way in which we have not only the infrastructure and the culture, but also the support team that a community needs to thrive.
I think about businesses and those businesses that want to create a healthy workplace and how we can partner, and of course every other dimension where we can lean in and be a great community partner and really add value to the community. I think that's in the future of Big Sky Medical Center, and our commitment is very strong to do that.
The telemedicine has just been remarkable for some of our patients to get the type of care they need, and especially get the care they need from specialists without having to travel. I'm excited to see that grow and develop.
We currently have psychiatry 2 days a week, and we are actively looking at and discussing adding pediatrics, women's health, cardiology, urology, among other things.
We're currently working on getting swing beds started here, and that gives folks that aren't ready to go home from the hospital but aren't really sick enough to be in the hospital a place to be and taken care of to get stronger so they can get home.
I see in the future that we will continue to learn and improve and touch the hearts and the minds and heal and do things in ways that we currently can't contemplate. And I have that commitment and that optimism because of the talent and the quality of the team that we have there.
You can build a beautiful building, it can be shiny and clean, but at the end of the day, it's the people who make a difference, and certainly the team at Big Sky Medical Center do make a big difference.
I've been the recipient of care here, as I'm sure many others have as well, and it was one of the most incredible experiences that I have had.
As we think about this great 5-year anniversary, this milestone in the history of Big Sky Medical Center and for Bozeman Health, I really think about all of those that have contributed to our success. I extend my personal and professional gratitude for the endless hours of work, for the commitment, for the passion that is part of the greatest work which we know, which is healthcare and delivering and caring for the needs of our community. And I just wanted to say thanks. And our future is tremendously bright. We have so much more to accomplish, and we're looking forward to those opportunities.